coming to you Saturday, February 21st. Um, second week down of chemotherapy, going on my third week, getting the port placed on Monday. For anyone who wondered why I didn't have it already, um, they were waiting on results from scans, because if I would have come back with any spread, I would be stage 4, and I would not be getting chemo intravenously. It would change the course of the treatment. Stage up to stage 3, they go for a cure. Stage 4, they go for just life longevity and comfort. A lot of feelings, a lot of different thoughts. Feeling okay though, I guess. Don't feel like I should complain. I'm very nervous about the port placement. That's got me really with a lot of anxiety. It really throws the nurses off that I don't have a port. They all act like they don't know how to do an IV intravenous needle. The port is really more for them than us. I mean, I guess if you have to get poked enough, it's for us, but for the most part, even they told me it's to make their job easier. So I get to wear a port in my body for 2 years or more so that their jobs are easier. You learn a lot while you're going through it. I've had some really great, for the most part, I've had great caretakers, nurses. Some are scary though, because they come in with either they don't tell you anything, or I had one that my doctor laid out how and when they were gonna do the pre-meds and the chemo, and she came in and just did it bip, 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 and said, well, we're gonna do it this way. And I had everything done in an hour. And maybe that's kind of why I'm feeling worse this time. I don't know. I just feel like if the doctor says it needs to go this way, I don't think a nurse should feel obliged that she can change that. He or she, mine was a she. It's scary as a patient when you're sitting there and you've got drips going in you, and they're just like a mad scientist deciding how it's gonna go. It's hot down here. It's like 70 something degrees. Air conditioner's blasting. Got my second haircut. Like I said, I wasn't ready to go straight to shaved. It's not coming out yet, but it's stressful. Every day I wait. Is this the day? Is this the day? Is this the day? But it's probably going to be in the next few days. I'd say within 2 weeks, this is going to be a different picture. Got a second wig. The Miles Pilet organization in Lafayette really is behind cancer patients. They let me pick a wig. Gave me 2 bags full of stuff, supplies, things I might need, things you might want. So, a lot of support. Working on, I said I was going to clean my room, organize my bathroom. I still haven't done it. I managed to pull some boxes out and rearrange some stuff. I used to work at Ulta, so I have a lot of what we called gratis. So I just have a lot of stuff. And I even had a family party before all this started and let people fill bags of stuff, and I still have a lot of stuff. when those influencers get on YouTube or wherever they go and show you their PR, yeah, they ain't joking. The brands give. I'm not even close to any kind of influencer. I just worked in a store and they were just happy to give. And the idea is you use it, you sell it. That's the idea behind it. They make enough. They make good profit. I don't talk a lot about that. Right now I've pulled out all my Peter Thomas Roth to use because chemo parches the skin. You dehydrate. And I have been dehydrated. I have to drink more fluids and add hydration. Yeah, that's where we're at. Talk to you later.